It's 5:16 on November 11th, and we'll go ahead and take the roll call. Pamela Gantz.
Here.
Teresa Gulias, I'm here. Dennis Highbury is excused. Devin Perrock.
Here.
And Robyn Lauritsen.
Here.
Kelly Burke.
Here.
Crystal Waller.
Here.
And Sarah's not coming tonight?
No.
Okay. And Cassie Shandell, is she?
She's not.
Okay.
She didn't indicate one way or the other.
Okay. All right. And who's this person here?
Oh, and this is Trista. She's
Okay.
our environmental health sanitarian.
Okay.
In correction, it's February 10th.
This
Oh,
February.
yes. Yeah, I think
Oh,
you
it
just
sure
read
is. Thank you.
approval of the minutes.
Boy, you can't even get the first sentence out. February 10th, though, that's very true. Okay. I guess I'm still in the Caribbean.
Yes.
Nice.
It was. We're going to go next to public comment on matters not on the agenda. And that would be, I believe you want to introduce yourself?
Do I pull that closer? or-
Yeah.
Do you have to push the button?
Yep. And it's
Hello, my name is Madeline Gensko. I live at a 525 North 10th Street, apartment 126, at Oak Meadows Apartments. My reason for being here is to report bed bugs and elder abuse that I experienced there. I moved into Oak Meadows Apartments in September of 2024. I love my apartment, and I have met some of the nicest people there. I thought I would stay there until I died, and when I moved in there, there was not a clue that there were a bed bug infestation in the building. After I was there about a month, there appeared a notice on the bulletin board that we should be on the lookout for bed bugs. And I brought a copy of that sign that was appeared on the bulletin board. Anyway, so that was my first knowledge that there was a bed bug situation there. Late one night, I was in my bathroom, and the vanity on the counter in my bathroom is white, and the light above it is very bright. And I looked down, and I saw this little bug, and his legs were moving, and I thought, I wonder if that's a bed bug. So I put it in a glass container and covered it up, and like I said, in my 84 years, I have never encountered a bed bug situation in all my life. So I called the De Pere Health Department and asked if someone could come and identify if it was a bed bug. And Trista came and identified that it was a bed bug. So then she looked at my mattress, and she indicated she did not see any bed bugs there. And she also looked at the mattress in a box spring in the extra bedroom. And so anyway, so then they set up a date that I received a notice that on a certain date that a man and his dog Chester supposedly seeks out bed bugs would be coming to my apartment. And while Trista was there, well, when I moved there in September, my friend across the hall, who was almost 90, had been complaining about sores on her arms, and she thought she was allergic to something she was eating. She was allergic, all right, but it was to the bed bugs that were biting her. So I asked Trista if she would go across the hall and talk to that lady. So she did, and she looked at that lady's mattress, and sure enough, she found bed bugs. And this couple is very elderly. The husband is almost 100. Like I said, the lady is almost 90. And this was so stressful to them because the instructions that they were given are what they had to do before the bed bug seeking dog and treatment would come. And luckily for them, they have 6 kids, so several of the kids came over and helped them to bag up things that had to be bagged up and do the extensive vacuuming that had to be done. And, you know, that's a billing for people who are 55 and older. And had I had any idea that it was infested with bed bugs, I would never have moved there. Because bed bugs are notorious for being difficult to get rid of. And so anyway, on the they did all that, and they left for the several hours that they were told to for somebody come and spray. So someone came and sprayed, but they still have bed bugs in there. And then I was scheduled to be have someone to come and check my apartment. The guy came with his dog, and so neither the man nor the dog indicated they located any bed bugs in my apartment. But, and the man asked me, have you ever been bitten? And I said no, because I didn't really know what a bite would look like. But Trista showed me on her phone, it was like a round red circle. And I didn't have any bites at the time that looked like that. I have other skin condition that I see a doctor, a dermatologist for. And so I was going to see him. So I was glad I had an appointment with him. So I went over to see him and for my follow-up from other things, and he identified it as a bed bug bite. I could, you know, it's not as bright as it was, but it was round red mark. I had one there and 2 over here, and, you know, and that was happened that night after they had been there. And so anyway, so I really was suspicious about the dog, because why didn't the dog, if he could pick up bed bugs, why didn't he notice that there was a bed bug in there, you know? And so anyway, and that was when, that same day was when he was supposed to go across the hall to check out the neighbors to see if their bed bugs were all gone. He never showed up. That couple, they went through all kinds of work, and the guy never showed up. So anyway, so I called the health department and asked why he did that, you know. And so anyway, and then today, the lady, she gave me a copy of the notice that she got that there were. She said that the manager, Joanne, had told her that the whole building was going to be examined for bed bugs, because that's what you have to do if you want to get rid of it. You can't just do the ones where they're already biting people. You know, you got to get rid of all of it. So anyway, but then from what I have a copy of what they gave that couple, and I'm trying to find it in my papers here. I know I have it, but anyway, so
You don't need to find that. For
yeah.
us.
So anyway, and they had told the lady that every apartment was going to get that letter, but I have developed a number of friends there, and 2 of the people that I spoke to are very honest people. They told me they didn't get that letter, and so I don't know what's going on there, but so then right after that lady brought over the copy of the notice they got, you know, when it was when they're coming back there, and Joanne, the manager, knocked on my door, and she scolded me for asking the other tenants if they had a bed bug problem. You know, I used to live at Bellevue because I thought for a while I was going to need assisted living, but as time went on, I didn't need it, so that's why I moved from there. But anyway, there used to be a sign on the window there that you have a right to visit or communicate with whoever you want to. And I listened to Joanne for a little bit, and after a while I said, you know what you're doing? You're trying to scare me. I consider that elder abuse. I'm going to report that. And I think there's been too damn much elder abuse going on. And I don't know, I'm hoping that DPR will do something to try to do more to get control of the bed bugs. And somebody said, I said, well, somebody has to come in and look for all the mattresses for every month for the bed bugs. And somebody said they don't have enough staff for that. I said, well, I'm sure this company that owns this building pays taxes to DPR. I said, if they don't have enough staff, that's not my fault.
Well, I'm really glad that you brought this problem to our attention. I understand you've been talking to Krista, and I'm really glad that you got your visit and she saw your neighbors and everything. It sounds like you've done everything you can at this point. And I believe Crystal just gave you the rights and responsibilities paperwork. So it sounds like it's a really distressing problem to you.
Well, I have my whole report from my doctor, my dermatologist, and these conditions, health conditions I have, are made worse with stress.
Absolutely.
And I brought along a note from another neighbor who couldn't come today because she had to go to the hospital to get a test. Otherwise, she'd be here. And she says, "Dear Madeline, I'm writing to confirm that I can't make the appointment today. I did have problems with bed bugs at Oak Meadows in 2023 for 10 months as the problem was ongoing." And she told me too that they picked on her because she reported things, And she said she doesn't have it in her note, but she would write that, if she had time and felt better. She told me it cost her over $1,000 to get a different mattress and stuff, And I have to rely on my son-in-law, my grandson, to help me, and I really didn't want to do any more moving because my son-in-law is in his 50s, and he's getting to that age that he can't do that heavy lifting.
Right.
And so I had planned to be there, and I really thought that I could work through this bedbug thing. My daughter, who's my power of attorney, lives down in Louisville, Kentucky. She sent me a spray that is supposed to kill the bed bugs and the eggs, because some things will kill the bed bugs, but they won't kill the eggs. She sent me that spray. So I thought if I did that eventually I could get my apartment. But, if all these other apartments are not taken care of, so when Trista came, she listed all these apartments, 124, 125, 126, 127, and says, and more, and there's people on the second floor, too, and so I really am sure DPR doesn't want to be known as the bedbug capital of Wisconsin, but you got to do something in order to avoid that, and also the elder abuse capital of Wisconsin. I expect to hear we elders, there's much we can do.
I think you'll find that the Board of Health and the DPR Health Department really will advocate for you within the extent of what they're able to do. And I think it's great that you contacted Crystal and Trista went out. And it sounds like they've been responsive to you. I know if I were in your shoes, I would want everything to happen yesterday. And it's scary and it makes you not want to go to sleep because you don't want to have bed bugs biting you during the night and everything. So I thank you for bringing your concerns to us. And what I'd like you to do is keep us posted on what the administration of your building does. Keep in contact with us as much as you need to let us know what they're doing.
Last Friday, I was just leaving the building, and a young man with a beard walked in. He said he was from ACC, and he went into the office with the manager, and then there was a sign on the door says, "Do not disturb for any reason, except an emergency," And I don't know what's going on in there, but there's also people have complained about the money management that, to me, they told me about things.
Have you contacted the ADRC at all to let them know of your concerns?
I went and visited my attorney. He did give me 3 phone numbers to call, and I'm not sure whose ADRC is.
Aging and Disability Resource
Okay.
Center.
Well,
And I'm
that's-
not sure that there's much
See,
they
it
could
used
do
to,
to
yeah, I
help.
did call there, and it used to be an assisted living place. And I asked her why it wasn't assisted living no more. And she says because of neglect and abuse. And from what I understand, there was a woman in apartment 116 who had sores all over her body, and her people must have been paying for assisted living, but they blamed the gossip. They blamed her. One of the other tenants told me that she was responsible for bringing the bed bugs there, and that she, when she was going to get kicked out, that she threw meat on the floor and just left it there. And I don't know what that woman's condition was, but if you're paying for assisted living for your family, you expect them to be taken care of,
Right.
and not expect them to take care of themselves. That's why you pay that money. But
Thank you so much for coming. And
okay,
we'll go ahead and keep this as an agenda item for our next meeting to see what the resolution has been. But in the meantime, between now and our next meeting, if you could please keep in touch with Crystal and Trista to let them know the status of what's being done and what other concerns you have additionally. Is there anything you wanted to add to that?
well, I do follow up because I know things don't happen overnight. I also know if you stop paying attention, whatever you started comes to an end with no resolution of the problem. I have
Right.
seen that in government before, and I'm hoping I won't see it in De Pere.
I think I can probably assure you that you won't. I've found in my tenure on the board that the health department is very responsive to the citizens. So I hope I can provide some assurance that to within the extent of what they're able to do, they'll support you.
Okay, well, what, Krista? Yeah, what she said on here, that ACC Property Management is responding to and addressing the bedbug infestation. Therefore, De Pere Health Department is not taking any enforcement action currently, and I hope that's not the end of it, because bringing
Well,
that.
that's why it's important
Yeah,
for you to keep
yeah.
in touch with us.
In the first place, the dog couldn't even find the bed bugs. They put so much reliance on a dog. What they need is a human looking at the mattresses.
Well, thank you, Trista, for investigating that and following up with the neighbors too. So, did you want to add anything or do anything more than adding to the agenda and having her follow up with you?
Not at this time.
Okay.
Okay, I would like to hope that Joanne will get a talking to about threatening us.
Well, and just like Teresa said, Madeline, the tenants' rights brochure, because the health department, that is a relationship situation between you and the
Okay.
apartment management. And so that tenants' rights resource is really going to be the advocate in a situation like that. We will definitely monitor the bed bug situation to make sure that progress is being made. But please reach out to the tenants' rights. It's
Okay.
a toll-free number that is on that brochure, and it outlines situations such as this and how they can help.
Okay, I did find a notice that my neighbors got that they're going to be, since the bug blasters will be at her place on February 14th between 8 and 10, and they have to be out of there. And but they told the lady that we were all going to get this. So far as I know, they're the only ones that got this. I got a scolding, but I did get one of these. I hope you do better than the building inspector did. I used to live at the Crow's Nest. Because one part of that is literally sinking into the ground. I don't know how they get away with what they do. That guy too, Bill Bodner, yeah, he was angry with me because I brought the building inspector over. He tried to bully me too, but that doesn't work.
Well, thank you so much for coming and sharing your concerns with us, and I hope you have some resolution quickly.
Thank you.
Did you used to live at the Crow's Nest?
Yes, I did.
Did you know Patricia Finderstone?
Who?
Patricia Finderstone?
No.
Oh, that was my mother. She lived there before she died.
Oh, yeah.
Yeah.
Uh-huh.
Yeah.
Yeah, I had friends there too.
Yeah. Nice. It was a very nice place.
Yeah, it was, yeah. But like I said, one side of the building is literally sinking into the ground.
Wow.
They seem to know everything I did.
Oh, nice.
I came and talked to the mayor. They knew that too. So I don't know if they got a pipeline right to the owners of the property, report to them what you do. So when he came and bullied me, I did write him up for elder abuse. Thank you. Hopefully I can get the cab to take me home. That was another thing. I had trouble reaching yellow cab. Can you believe it?
Wow.
When did that ever happen to anybody? And then the guy got the wrong directions. He took me way down to Green Bay. And I told him about the situation. Boy, he made every effort to get me here as soon as he could. I appreciate that.
You
guy.
did a good job. You gave him plenty of time, so.
Thank you.
Right. I'll give her a ride home.
Yeah.
I don't have a problem with that.
Okay. I don't put up with no crap from nobody.
That's my kind of woman.
That's right. That's right. You
If you're
stay
still
strong.
here when we're done, we'll give you a ride home.
Yeah, I'll give you a ride home.
Well, I appreciate that. Okay, where should I wait for you?
In the lobby right there.
I'll say in the lobby?
Mm-hmm.
You
Okay.
can sit wherever you want.
Yeah.
You can, if you're interested, you can stay for the meeting too.
So I'll stay for the meeting.
Sure.
Okay.
Okay.
That just irritates me.
Yes. Well, we'll move on to the approval of the minutes for the November 11th, 2020.
Make a motion to approve.
Second.
Second, okay. Minutes for November 11th, 2024 meeting have been approved. We want to welcome our new Board of Health member, Robyn Lauritsen. You want to give us a little intro of yourself and your
Sure.
background?
Yeah, I graduated nursing school in 2012. Before that, I got a Spanish degree, just because I had to get a degree in something. I was a Nordic skier as well, so graduated from UWGB with that. Was a nurse for about 8 years, and then went back to school for a nurse practitioner. And I've been with Bellin Health for about 5 years now.
Yay,
So,
lovely.
yeah. Yep. Speaking Spanish.
That's awesome.
So,
That's a
yeah,
wonderful
yeah.
combination. It's so
Yeah.
useful in nursing.
Yeah, so it's
Well,
been great.
Wonderful. Well, welcome to the Board of
Yeah,
Health.
thank
We're
you.
really happy to have you.
Thank you.
Are you related to Jill?
Yeah.
Oh, yeah.
I was just
That's
with
her
her on Saturday night. Oh, really?
Oh, okay.
Yeah, she came
Oh
to
my
the
gosh.
West Centennial with me.
Yeah, shit.
I know her
Cool.
from-
So sweet. Oh, that's so cool.
Yeah, that's my
And
I
I
know
was
her from
just
AAUW.
skiing.
Yeah, it's AEW. She's trying to convince me to do that.
Oh,
Just
yeah,
haven't.
please do. That'd be wonderful.
I've been to a lot of meetings. We're
Well,
trying to get
that's good.
Shayna to join too.
That's
so-
great.
Oh, nice.
That would- y'all can come join.
Yep.
Small world.
Yep.
I was just skiing with her too in
You
Jackson
did?
Hole.
Oh,
Yeah, I love her.
Oh, you were
She's
skiing with
awesome.
her. That's awesome. But you were on there on a separate trip.
Yeah.
Oh, cool.
I was there
funny.
visiting friends
Oh
and
my
I ran into
gosh.
her and I mean we knew we were both going to be there at the same time but we
That's
ended
so
up hanging
cool.
out a little bit so that was nice.
Oh,
Small
cool.
world, yeah.
Well, I'm
Yeah.
sure I'll see you more.
Oh, that's so funny. Yeah. I
I
love
thought you
her.
looked
She's the-
familiar.
yeah,
I've
she's-
probably seen you at one
Yeah.
of the AAUW meetings.
Yeah, I come with my mom to like a couple meetings. A couple.
She's
times a year.
Jill's your mom?
Mhm.
Oh, that's
Yep.
cool. That's
She told me I
very
had
cool.
to be a nurse. I wanted to be a teacher, and she's like, "No, you're gonna be a nurse."
That's what my mom did too. But I'm glad she did.
Mhm.
So,
Yeah.
Awesome.
yeah, very cool. Well, Crystal, you want to tell us about the grants?
Oh, sure. Next agenda item. So, just like last year, I did put a summary together, as Debbie did prior to me, with our current grants, so you all can see what we have on the docket. So, I also included if there was an increase or a decrease from last year's funding. You'll see most significantly for the maternal child health grant, we did see a decrease of $1,734. And when questioned the state on that, they said it is because our birth outcomes improved. So, I mean, that's a good thing. But our funding, it's based on a formula, so that affected our funding formula. And so we saw a decrease in funds for that. So, lead, there was no change. Communicable disease, there was no change. And then prevention, there was a slight decrease of $551, but preparedness, we saw an increase of $689. We haven't started spending the public health infrastructure grant to date. So that goes until November 30th of 2027. So that remains at $105,800. Now, COVID immunization has been approved for carryover until June 30th. And at that time, and still is at about $18,785. ARPA, we received notice. Now, this is the public health ARPA, not the general city ARPA, but we received notice at the very last moment that they approved, they being the Department of Administration, approved that carryover until December 31st, 2025. So we had it's about 6,000, a little south of that. So that will carry over. The two biggest purchases with that money, and we have been reinvesting in the community as well, but the biggest purchases in 2024 were was the furniture upgrade in the health department, as well as we invested in the community center, like communications equipment. So televisions, microphone for programming. So when the health department is over there doing programming, that we can utilize some new equipment. So that was
That's
good for them and good for us.
Yes.
So
Yeah.
that is the summary.
We had some problems with when we had the nurses come over and do some presentations
Oh.
for League of Women Voters. And so I'm happy to hear that they got new equipment.
Yeah.
Nice.
Do you have a truck?
Very good.
A truck.
So the only thing is, I'll just make a note, that star, that asterisk, we are still awaiting the contract amendment from Wisconsin DHS for that carryover amount. So that'll be going probably to finance and then to city council, because we won't have another Board of Health meeting
Until,
until May.
okay. All right.
So
Okay. Very good. Oh my. You okay?
Good. Just making sure you're all awake.
yes, still here.
Okay. So, and the communicable disease report?
Yeah, so Danielle provides the summary for us all to review. So in 2024, sexually transmitted infections remained consistently high. This is not abnormal. It's the most reportable condition in the state of Wisconsin, so we are not out of the ordinary there. What was elevated was, of course, our pertussis cases, our whooping cough cases. And so we did have 3 area outbreaks, and 0 in the previous 4 years. So that was, again, in line with what the state, the region, and the state, and even the nation saw. So we did participate in outbreak investigation as well.
Did you note any correlation with fewer vaccinations?
Actually, a lot of the people who had pertussis confirmed were vaccinated, but it was at an age where the booster was waning. And so I think what I would recommend to the scientists would be to develop a vaccine that offers better coverage, whether it's whole cell.
Like just pertussis,
Right, right.
not the
And
tetanus
so
and all that.
so it does offer some protection in that, people maybe don't get as sick, but it doesn't prevent the disease itself. So we had a mix.
Interesting.
Yes.
Okay.
So that, and then for the quarter summary, you maybe saw on the news, norovirus illness outbreaks. Again, individual cases are not reportable to the health department. However, when there are clusters of cases, that is what is reported. So most recently, I did a media interview on Fox 11 for a cluster of cases over at De Pere School District, and continued to do education in the community through social media and other venues on how to prevent, and of course staying home when you're sick, right? So we do have latent TB infection course treatment that has been completed in this last quarter, and then another treatment course beginning in a new person. So we do direct observed therapy for that. Now we do have a shortage of one of the medications statewide, so that may affect the treatment course. But again, these are people who do not have active tuberculosis. They are infected. So we're trying to give them antibiotics so they don't become active. So that's the whole purpose of that direct observed therapy. So those are the highlights.
Okay, very good. And the next agenda item is the tourist rooming houses.
Yeah, so Trista does this report for us, thankfully, every quarter. And I would just highlight, and she's here too if you have any questions, but she has been so very busy with the new tourist rooming house license. These are the short-term rentals in preparation for the NFL draft. So you'll see in the report that she developed that we have seen quite an influx, and pre-inspections are also added in there. So anytime that there's a new establishment in the area or a change of owner, that all adds to the workload. So she is navigating that like a rock star and doing a really good job. She also was able to complete a self-assessment. Think of it as like accreditation for environmental health programs. So she was able to do a self-assessment of some standards from the FDA, and together for anything that was weaker or areas that were weaker, looking at developing an action plan. And this is, again, a voluntary program, but really best practice for not only small health departments, but larger health departments. So kudos to Trista for taking that on and doing that assessment. It's really a quality improvement opportunity. So really credit her and her work in doing that. And then finally, just to realign some of the workload for Trista, she is a one-person show here, and you will see in our performance dashboard, our program performance management dashboard, that she is exceeding, in a couple areas as far as her volume. And so we are coordinating with Brown County Public Health to explore the feasibility of a memorandum of agreement to delegate some of her inspections related to events being hosted at Brown County Fairgrounds. And really what brought this to our attention was in November of 23, the city entertained a lease, I guess you would say, with Brown County so that they manage all of the events over at the fairgrounds. So it made sense to look at Trista's workload and the possibility of entertaining this agreement because they're managing all the events to then have their inspectors in turn inspect the events that they're managing. So working with Eric Erdman in developing some sort of addendum to that lease agreement to then be able to look at ourselves and then share with Brown County to see if they're comfortable. And then if all parties are comfortable with the agreement, then we would bring it to likely finance if it happens before the May Board of Health, and then City Council for review and approval. But just wanted to keep you all informed that this is something that may help Trista's workload. And then just align it for efficiencies because they're managing the Brown County Fairground events.
That makes sense. Very good. You have your own Doge department, huh?
Doge department, yes. So if anyone has any questions for Trista, she did come tonight, but just again, kudos to Trista for all the work that she's doing.
Yes.
She really is a spectacular environmental health inspector, and appreciate all of her work.
We're lucky to have you.
Thank you.
Yes.
Thank you. Really, thank you for all you do. And I guess then we're on to the Q4 year-end dashboard results.
Yes. So this is something that I started, when was that? Maybe May of last year, but really looking at performance management. And again, just reiterated in that memo, the purpose of performance management. This isn't like employee performance, it's program performance. And so we finished the full year with our first stab at this programmatic monitoring. And a couple of things I think really stuck out. Like I said, we're monitoring and revising the environmental health sanitarian's capacity to meet the ever-growing demand for her services. So, we're trying to work with developmental services, talking about that new code enforcer to see if, that new position can support anything, and take off Trista's plate or even provide backup to some of her responsibilities. So that has been positive, as well as, the Brown County Public Health, exploring the feasibility of that contract, I think will be super helpful for Trista. But that's really one thing that stuck out and we'll continue to monitor. Also, as you could see in that dashboard, our influenza vaccination numbers didn't quite hit the mark. And I did take last year's numbers to benchmark our goal. And so I think what we're seeing is we're no different than any other jurisdiction or the immunization rates across, this region, state, and nation. We're down 10% for influenza uptake for vaccinations. So I think this is a good opportunity for us. We see the decline with our numbers. What can we do? What can we refresh? What new partnerships can we create? So we do have an upcoming meeting with the Multicultural Center to see if potentially we can do some education with a documentary and then maybe provide vaccination on site over at the Multicultural Center. But stay tuned in 2025 to see how we can further explore those partnerships. So I would say those are a couple of the highlights from
That's
the
very
dashboard.
good. Are you still getting calls from people who don't want you to promote vaccines?
We have gotten calls from some who don't want reminders for recall for their children.
Okay,
But other than that, we haven't really
Okay.
experienced anything
that's good.
else.
Okay, wonderful. So, let's see where we are now. On to the director's report.
Yes. So just wanted to let you all know that we have 2 students with us right now. We have Abigail, who is enrolled online as an undergraduate nursing student through Grand Canyon University. She currently works at Ascension Health System in Chilton, and she has been doing great and just really engaged with learning public health nursing and the role of public health nursing and how that differs from traditional direct care nursing in a hospital setting. Our second student, Alyssa, is a graduate student here with us from Michigan State University. She also lives locally, and she's helping us with our Chapter 140 review as we try to level up to a level 3 health department. So she's been helping us gather that documentation. We'll be presenting that day with us.
I love how you're using your students. This is just great.
Yeah, it's been really, I think it's just beneficial for everyone, having those specific projects, and then of course they get the experience too.
Right. Excellent experience.
Oh, and then also, this is new, we are exploring the feasibility of becoming a donor milk depot, and that is to support breastfeeding in our community. So we no longer do direct care type home visitation, peer lactation support. But this is a way that we can change policy, systems, and environments by providing this as a resource. So what it means is that we would be a drop-off site for breast milk, and then the breast milk would become, it would be picked up by this organization, and it's regulated, very heavily regulated, and the milk is pasteurized, and then is available for families who need it.
And coming from bereaved parents, that must make them feel like they're
contributing.
Yes.
Yep.
Oh, that's wonderful.
Yep. So more to come on that.
Exciting. Exciting.
And then finally, this is, Teresa, your recommendation to give an update from the Wisconsin Association of Local Health Departments and Boards. We met in January. We meet on the odd months. And they talked about, one of the biggest things was the H5N1, how they're monitoring the situation and what partnerships we should bring in to just coordinate information, not only for our region, but also statewide meetings. So just talking about bringing in DATCAP and the UW Extension, working with farms. Of course, here in the city of De Pere, we don't have farms, but we have farms just outside of our jurisdiction. And so just really information sharing. So that is going to be probably what is on the March agenda. So more information on that. And again, I send that out, to you all and invite an open invitation to that. And then you all saw the save the date for the May meeting. That would be they're really focusing on the role of WALDAB and Board of Health advocacy, and then they're going to be discussing the current legislative priorities for the organization. So they will offer that virtually as well. So if you can't attend with me in person, you're more than welcome, if it works in your schedule, to click in
Might have to make
virtually.
it work. WALDAP seems to be doing a lot more now than they have in the past.
Yeah, right. And they have an executive director now, and I think that really
makes
helps.
a difference. They sent out a thing on a virtual conference that we could attend, and it was related to refugee status and the how healthcare is provided and what we're doing in the state of Wisconsin. It was just excellent. So
Yeah. Yeah, that is good.
Yeah, I would
good
love
to
to hear more about that. Well, thank you for adding that in.
Yes. And then finally, the Chapter 140 review, that meeting date has been set. I have invited the city manager, the mayor, Shannon, the assistant city manager, and now all of you. So if you're interested in participating in that review, again, this is going from a level 2 to a level 3. That's what we're trying to do here. That is the date and time. It will be held in the Nicolay Conference Room, but you will need to let me know if you're interested, because if I have a quorum, I need to post it as a public meeting. So please let me know well in advance if you are wanting to participate. Otherwise, we will definitely have it on the agenda, the results of that review.
Yes, I will probably, if I can, I will definitely come. Okay, and let's see, the next thing is the DPH Consolidated Contract Grant.
Yes, so this is just our regular contract, and this is what makes our packet so long. But this will forward on, if you consider and approve it, it will forward on to Common Council for review and approval. So we will need a motion and a second here to be able to forward that if you're interested.
And we've all read this and looked through it diligently.
With a fine-tooth comb.
Do we have a motion to approve the grant agreement, the consolidated contract grant agreement?
Make
Motion
a motion
to
to approve.
I'll second.
Thank you. All in favor, say aye.
Aye.
Opposed? Okay, there you go.
Motion carried. Thank you.
Motion carried, yes.
Thank you.
No problem. Okay, and that's long. That's really long.
I know.
Woo.
I'm going through it too. There, finally. Oof.
The EpicCare Access Agreement, I'm interested in hearing what that's about.
Right. So we previously have had approval for the same sort of access to Epic. So we can do our public health follow-up with Gunderson, because they're merging with our very own Bellin to amplify. And also HSHS and Aurora. So we have all of those contracts in place. This is just adding another one. So unfortunately, in this environment, we have to negotiate this with every health system to be able to have access, right? So it definitely improves the efficiency in our daily tasks, and you will see that in our program performance dashboard. You'll see our response time has improved over the quarters. So this is just another with Ascension.
That's awesome. Awesome. Very good. Okay, back to the
So I
agenda.
will need a motion and then approval if you agree with that, because this also would need to go on to council.
Do
I'll
we
make
have
a motion to approve.
Thanks, Pam.
Second.
Thanks. Okay, very good. So, future agenda items, we want to make sure that we add the follow-up on the bedbug situation and the concern about elder abuse as well. We'll add those on,
Okay.
okay? And keep us posted and let us know about anything that happens in your building, okay? We will follow up too. So, unless somebody else has anything else? You guys have anything else?
Nope, not me.
Do we have a motion to dismiss?
I'll make a motion.
Do we have a second?
A second.
There you go.
All in
Let's
favor,
get in
say
line.
aye.
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 Aye. Opposed? And the motion has passed. The meeting is adjourned.